all the faculty, delegates, doctors, colleagues, teachers, members of the press for having come here today. We're very thankful to Madam Hemlata also for having gracing the occasion. So as all of you know, Yashoda Hospital has a legacy of around 30 years. గత 30 ఏళ్లుగా తెలుగు ప్రజాధికానికి యశోద హాస్పిటల్ వారు సేవలు అందజేస్తున్నారు. So we started in the year 1989 with a less than 100-bedded hospital in Somajiguda, and right now we are an institute of more than 1,500 beds with over 800 doctors, 10,000 employee base, and an army of more than 2,000 nursing personnel. So the constant vision and the constant guidance that has been given to the Yashoda group of hospitals by the directors is the concept of constant upgradation of technology, constant upgradation of equipment, and a constant updation of knowledge. Now this kind of a force is phenomenal in leading to growth of the hospital and in giving quality care to the patients. So we follow what we say, we practice what we preach. So Yashoda Hospital, when it says upgradation of equipment, upgradation of technology, we have many firsts, not only in the state of Telangana, but also in South India and in the country. So as all of you know, the latest feather in our cap is the intraoperative 3 Tesla MRI, which is the only installation in the entire country of India. We're using this technology to operate on brain tumors. We also are the first ones to have commercially purchased the spirus enteroscopy and the endocytoscope. When a gastroenterologist does an endoscopy, he sees a gross lesion. But with endocytoscope, where we have a 100x magnification, a gastroenterologist is now a pathologist. He is going to see the cells in the epithelium, he is going to see the nuclear atypia and the dysmorphism in the cells. So that's how far technology has advanced, and this is how interested Yashoda Hospitals is in getting this kind of a latest equipment to the people of our country. Coming to liver transplants, we have been recently felicitated by the ministers at the central level in Delhi, by the Minister of Health and Family Welfare, for having the largest number of cadaveric liver transplants in the entire country. We are doing extensive work in the field of transplants, and our results are comparable, if not better, to that of the international standards. We have also recently launched the Stroke on Wheels mobile unit, wherein this ambulance is equipped with the facility of giving thrombolysis to the patient on the road. The patient travels towards us, we travel towards the patient, and then within the golden period, we administer this thrombolysis. In case the patient comes to us after the golden period, we go ahead and do the mechanical thrombectomy. Again, it's with great pride that I want to inform all of you that the series of cases of mechanical thrombectomy that we have done in our cath lab by our interventional radiologist is one of the largest in the South India and comparable to premier government institutes. Technology like the intraoperative neuromonitoring, where we monitor all the cranial nerves, is again a pioneering technology done by our anesthetist in Yashoda, and we are actually going to institutes like Nimhans and PG and Chandigarh to train the people there and to train all the students in this intraoperative neuromonitoring. Coming to cardiology now, as all of you will see today and tomorrow, we have around 6 cath labs and we do more than 500 PTCAs, and we no longer are a tertiary care center. We now call ourselves a quaternary care center because we get referral cases from the tertiary care centers. We also routinely do short ECMO. This is especially done, as Dr. Rachikar and Dr. Shishikant will be informing all of you. This is done for patients with very low ejection fractions and who are very, very high risk. And one more new area into which Yashoda Hospital has already ventured and will bring out in the open very soon is the extensive collaboration with all the technological and engineering institutes, not only in our country but abroad also. So we already have drafted a lot of collaborative agreements with the IITs, BITS and other engineering institutes to work on bringing all the technological advancements into healthcare in order to make healthcare more affordable, in order to make it much more safer, and in order to make it less invasive to the patient. So thank you all so much for gracing this occasion, and I really hope that all of you will leave a bit more wiser than how you have come. Thank you so much.